Well, hey everybody, this is Robert, and welcome to today's show. And there's more going on in the world than just the novel coronavirus, as you know. But a lot of other things aren't getting a lot of attention. For example, the flu. You don't hear hide nor hair of Ebola much anymore. And there's something going on in Nigeria that needs some attention, and that's the Lassa fever outbreak that's been going on since late 2019. But just in the past 4 weeks, Nigeria has reported 258 confirmed cases of Lassa fever, including 41 fatalities since January 1st. And that includes 95 confirmed cases and 3 probable cases just in the week January 20 to January 26. So with 19 fatalities last week, that's a 20% case fatality rate. Very, very serious outbreak. In this 95 cases that were reported between January 20th and 26th is up from 81 cases the week prior. So it only appears to be building up a little bit of steam. It's been reported in 19 of Nigeria's states across the country. The case fatality rate so far for 2020 is around 16%, a little bit lower than last year at this time. And most of the confirmed cases are from 3 states, Edo, Ondo, and Ebonyi. So there's also been several healthcare workers that have been infected with Lassa fever, doing their jobs in the care of patients. And just last week, 5 more healthcare workers tested positive. Last week, the Nigerian Centers for Disease Control reported intensifying response to the Lassa outbreak. And it says, in response to the increasing number of Lassa fever cases across states in the country, the Nigerian CDC activated the National Emergency Operations Center on January 24th. The National EOC includes representatives from the National Emergency Management Agency, Federal Ministry of Agriculture and Rural Development, and several other agencies, including Global and the US CDC, the World Health Organization, UNICEF, and other global organizations. Let's see. In addition, 5 laboratories in Nigeria have the capacity to diagnose Lassa fever in Nigeria. These laboratories are critical to reducing the turnaround time between identifying a suspected case and a confirmation. Nigeria is contributing to research and other activities for the development of a Lassa fever vaccine. And the Nigerian CDC and the 3 main treatment centers in the country, the Irua Specialist Teaching Hospital, Federal Medical Center Owo, and the Alex Ekwume Federal Teaching Hospital are set to commence Lassa fever epidemiological studies that will provide data to guide research and response activities. So there's a lot of activities going on in Nigeria as this outbreak continues to grow throughout the country. It's not just in one little part of it, it's in 19 different states. And I mentioned that there's been some healthcare workers that have been infected. And a couple weeks ago, the Nigerian CDC put out a healthcare advisory for healthcare workers. And basically, they describe how Lassa fever is spread and some of the signs and symptoms to look out for, and ways to prevent getting infected, like the obvious things like handling blood with appropriate precautions, using the appropriate PPE, appropriate cleaning and disinfecting of contaminated surfaces and supplies and equipment, and the usual suspects. So they published that, obviously of concerns of their healthcare workers becoming infected from positive patients. The World Health Organization had the following to say a couple weeks ago concerning the Lassa fever thing, and I just want to talk about some general things they had to say. It says an annual upsurge in the number of reported Lassa fever cases is a usual occurrence at this time of the season in Nigeria. Since 2018, an increase in the number of reported cases is typically observed between December and June, beyond which sporadic cases are reported throughout the rest of the year. And the main propagator, of course, is human contact with food or household items contaminated with the urine or the feces of the mastomys rodents. So it's again another zoonotic disease. And that really brings me on to the next article, because as the World Health Organization says here, an annual upsurge of the number of reported Lassa fever cases is a usual occurrence at this time of the season in Nigeria. And I saw this article in a Nigerian news source called Punch. And this gentleman named Greg Adagwu, he's the environmental journalist with Punch. He had some things to say. He's saying this is probably not really necessary, and maybe the government should take a look at some other options. And he starts off the article talking about novel coronavirus because Nigeria, like every other country, has put out various warnings looking out for the novel coronavirus that could come into their country. But he says, after over 50 years, Nigeria has yet to overcome the infection, which is preventable, talking about Lassa fever. Lassa fever is usually initially spread to people via contact with the urine or feces of an infected multi-mammate mouse. Spread can then occur via direct contact between people, hence the healthcare workers. And he talks about ways to prevent it, avoiding the rats, the rat excreta, discouraging rats from getting near your home by covering food and clearing away rubbish around the house, and even keeping a cat, he mentions. But on the one hand, the government seems not to be creative enough to tackle Lassa fever. On the other hand, many of our politicians and public officers use the opportunity presented by the perennial epidemic to bleed the country dry. So some harsh words from this author. The casual observation will easily reveal that the government's body language reeks of crass insipidity. At the present outbreak, the Nigerian CDC issued a statement recently and said that the increase in the number of cases of Lassa fever at this time of the year is not unusual due to ecological factors. By ecological factors, the agency meant that because the Lassa fever is caused by the multi-mammate rat, which usually invades human living quarters at the end of the planting season, we are officially in open season. In other words, the government does not do anything to prevent it, but waits until it starts killing Nigerians. Again, very harsh words by the author. So year in and year out, the government expects a body count. It says, this means Nigerians should not expect respite from the outbreak because Lassa fever season in the country peaks from November to May. The country has no effective measures to curb the spread of the killer disease and has so far focused only on curative measures. This is why health agencies embark on contact tracing of persons who have been suspected to be in contact with patients. This has become a yearly occurrence with hundreds of people infected and dozens of fatalities recorded apiece. He says, but to me, that there is no vaccine for the disease does not mean that we cannot conquer it. It's highly preventable. And he talks a little bit about the budget and prevention and some other terms like deraticization. Never actually heard of that word before. And let's see. But basically, what he boils it down to is this. Let me see. If our government and its functionaries, elected and non-elected, were serious, Lassa fever would not be dealing with us the way it presently does. In fact, it is easier to prevent the epidemic than it is to respond when it has already hit the town. A proper eco-based strategy will not only end the fatalities, but will also create employment by raising a new corps of homegrown rustic green soldiers augmenting the work of mainstream environmental health officers. The same way vigilantes help the police, he says. The overall strategy is simple. At the end of the rainy season in Nigeria, around September, rodent populations peak, having thrived on all the food available in the lush farms. Then dry season hits. Around October, farmers start to clear their farms for a new season of planting the following year. This pushes the rats out of the croplands and into villages in search for food. Some of these rodents may carry the Lassa virus. Following this cycle, immediately the planting season ends, decontamination and quarantine should be deployed to identify hotspots, with the primary aim of preventing a wholesale invasion of rats from farms to human habitat. So that's what the author has to say. And I'm curious, I mean, if you're a listener or a viewer from Nigeria, I'd love to hear you give us a response down below. Do you agree with this gentleman, or is the government doing everything they can? Are they proactive enough? Are they just being reactive? Or, is Lassa fever just a known part of life in Nigeria now, at the end of planting season, December through May or June? So I'd love to hear what you have to say if you're from Nigeria. And anyway, that's all I got to say about Lassa fever. It's a very important outbreak that's going on right now that's kind of being drowned out by a lot of the other things that are going on. But it's a very important outbreak with a high case fatality rate. Anyway, please comment below, subscribe to the channel, share it with your friends. That's the best way to get these types of information out on this YouTube page and help this YouTube page grow. And I'll see you next time on Outbreak News TV. Thanks a lot.